I'm James Swanwick. Welcome to the Alcohol Free Lifestyle Podcast, where you learn to live a life of health, wealth, love, and happiness. The idea that alcohol is good for your health is so ingrained in many cultures. But is it true? Or is it flawed science? Today's guest is Professor Tim Stockwell, an emeritus professor at the University of Victoria in Canada and a scientist at the Canadian Institute for Substance Abuse Research. And Professor Stockwell, in my view certainly, is one of the world's top experts on all things to do with alcohol, its effects, the role of lobbyists in the alcohol industry, government policy. And in March 2023, Professor Stockwell published a 4-year-long study looking at 107 previously published studies on alcohol. And this study was published in JAMA, which stands for the Journal of the American Medical Association. And the study involved nearly 5 million participants over 4 decades. So just to put that in context, or just to repeat that rather, Professor Stockwell studied 107 previously published studies on alcohol involving 5 million participants over 40 years. So in my view, if there's anyone who's versed enough to be able to speak about alcohol and its effects, then it is Professor Tim Stockwell. Professor, welcome. I'm so happy to have you here.
Thank you very much. I should say I had quite a lot of help with that study. I just didn't read all those studies single-handedly.
You're very modest, sir. And how long have you been studying alcohol and its effects? When did you start this and how did you first get into it?
Thanks for that question. It's right, my whole career. I guess I finished my first degree when I was living in England at Oxford University in psychology, and I applied for a scholarship at the University of Edinburgh in an epidemiological research unit, the epidemiology of psychiatry. And I had a choice of things to do my PhD on, and I explored and I came across a book, a guy called Henry Walton, called Alcoholism. And as a psychologist who was obsessed with giving up my own habit of smoking, and I was just fascinated by this whole addiction thing, I thought, right, this is really interesting, and kind of started there and has branched off in all sorts of extraordinary directions ever since.
What year was that when you first?
Oh, yeah, you can see how ancient I am. That would have been 1975. Yes, the autumn of winter, 75, 76.
So almost 50 years you've been studying alcohol and its effects.
I'm afraid so. Yes, that is true.
Well, incredible. Well, I'm so happy that you are here to give us your guidance on all of your learnings over the years. A little bit later, I'm going to ask you some questions that our clients have actually prepared for you. And when I say clients, we have a stop drinking program called Project 90, and we help people to stop drinking for at least 90 days, from which point they can then powerfully choose whether they wish to remain alcohol or to introduce some modest amounts of alcohol back into their life. And in preparation for our conversation here, I asked them each to send through a question. So I'm going to look forward to presenting those questions to you and getting their answers a little bit later on. Tim, or Professor Stockwell, I'm sorry.
Tim, please. Yeah.
Tim. All right, Tim. We'll call you Tim the remainder of the call. Thank you. Tim, just generally speaking, with 50 years of research, is the consumption of alcohol, in your view, healthy, unhealthy, and why?
I mean, if you look at research evidence, I think the overwhelming evidence is for harm in a dose-response way, which means the amount of harm you receive is entirely related to how often and how much you drink. And so then we can, if we wish, zero in on the question of whether small amounts of alcohol may be healthy. And there's lots of claims about that. There's actually claims that large amounts of alcohol are healthy as well in relation to preventing heart disease. And I think that we can be pretty sure that that is not the case. But there's a controversy around low volume alcohol use, and I have a skeptical view about whether there really are benefits. It's hard to disprove them. It's very hard to disprove things. So I kind of take a skeptical position and feel that a lot more work needs to be done to check that out, because there's strong grounds for doubting it at the moment, that alcohol in moderation is good for you.
If we go back to 1991, there was a French scientist by the name of Serge Renaud who became a hero of the wine industry when he announced on the American TV news show 60 Minutes that drinking red wine was good for the heart. And you might recall this particular episode, Tim, and the 60 Minutes journalist, whose name was Morley Safer, he latched on to the claim, and he was smiling at the end of that particular episode as he raised a glass of red wine to the 33 million viewers who tuned in to that night, that episode of 60 Minutes. As I understand it, the day following the episode, US airlines reportedly ran out of red wine. Red wine sales began to skyrocket. For the next month, I read a report that suggested red wine sales in the US spiked by 44%, which is an additional 2.5 million bottles. And then when the episode was re-aired in 1992, a year later, the sales spiked again by 49%. And sales of red wine for the entire year between the first screening of the episode and the second were up by a total of 39%. And as I understand it, Americans, and certainly the world, never looked back, devouring red wine as if it was protecting them from death and somehow improving their health. Do you recall that 60 Minutes episode and what you observed in the months or years afterwards?
I do recall, and one little extra detail I remember was that apparently these little neck sleeve things were placed by some red wine manufacturers in the States, which were basically saying this is a health product. It's been proven to protect you against heart disease. So there was no filter, there was no regulation to stop them doing that at the time. They got away with it. So for a while, red wine was sold with these added little pieces, these little neck sleeves, just basically saying, drink this product for your health. Anyway, so you're right. I think it was kind of a turning point, but it was like a lot of things had led to that point. But that's when it became most public. And somehow it's like one of these viral pieces of information or knowledge or information, or it's really a hypothesis or an idea. And it's spread all over the world. You can go almost anywhere, I believe, and ask if people have heard of the idea that red wine is good for your health, or wine is good for your health, or just alcohol is good for your health in moderation. It's actually also an ancient idea. I mean, you can find sources in Greek literature. People have done studies of the Bible, the Old Testament, and looking for references to alcohol and finding equal numbers of references making positive claims as negative. So, we've got this conflicted idea about alcohol going back millennia, and probably basically century, and it kind of fits. This whole 60-minute thing did fit kind of nicely with, I think, so many people in high-income countries particularly. Most people drink alcohol, and there's this comfortable view that a little is fine, moderate drinking does no harm. There's a few extreme people with problems who run into difficulties, but otherwise the rest of us don't have to worry. So I think it's a profoundly comforting message to hear that it's actually doing you good. It's not just not doing you any harm. Yeah, it was a big moment, and I think we've been living with that. And I think in the last 5 years particularly, there's a growing awareness that the science behind this idea doesn't really always stand up to scrutiny.
So it's 2024 as we're having this conversation, and certainly your most recent report suggests that 5 million participants over 107 previously published studies suggests that the idea that alcohol is good for us or good for heart health is fundamentally flawed if I was to read your report correctly. Maybe I'll just ask a very specific question. What did your 4-year long study looking at these 107 previously published studies on alcohol reveal?
So we took two different approaches to looking at the question. The question, we were looking at alcohol's effect on death from all causes. So it's like, it's the ultimate measure. We weren't looking at heart health particularly, just alcohol and death from all causes. And we did a systematic review of the entire published literature. We had the most studies that anyone else had ever put together to look at death from all causes and alcohol. Basically, at the end of it all, we find the high quality studies had like a straight line increase for the risk of premature death of all causes. And they show a straight line increase in risk the more you drink at no safe level. There's a slightly increasing risk at first that accelerates as people drink more.
If I was to create a bumper sticker on the results of this study, if I'm hearing you correctly, it is that chances of premature death increase with any amount of alcohol consumption.
That's a long bumper.
It is a very long bumper sticker. Is that accurate? Am I being accurate in assessing that? If we take the most accurate studies of those 107 studies, and we break down the data, it seems to me like what you're suggesting is the study shows that any amount of alcohol use increases the likelihood of premature death.
Yes, and it's a small risk at low levels. It was an international news story that the Canadian health officials recommended low risk drinking to be 2 drinks a week, and moderate risk 6 drinks a week. And it was like the lowest ever guidelines, and it was a viral news story. But the gist of their message was, maybe this is a better bumper sticker, drink less, live longer. And at 6 drinks a week, we calculated that's round about 3 months of life lost for the average person. So if you get, 100 people drinking 6 drinks a week on average across them all, they would be living 3 months less. And a lot of people absorb that information and say, well, I probably will be very old by then and won't have much quality of life. I'm going to make hay and live my best life until then. But there's another calculation which says that on average, you lose 5 minutes of life for every drink that you consume. The average life expectancy lost per drink of alcohol consumed is 5 minutes. And we found with even young people trying to absorb and digest that information, that's fairly arresting. Another similar little factoid like that is at low levels of consumption, the risk of dying from alcohol, 1 drink per week is the same as 1 cigarette per week, or 1 drink per day is the same risk as 1 cigarette per day. We've all got to head round the risk of lung disease from smoking cigarettes. But the idea that there's an equal risk, 1 drink of alcohol is the same mortality risk as a cigarette, is new. But it is based on whether the analysis I just described is correct. So let's be very clear about that. And we've published that study. They're good journals. We went through peer review. That doesn't mean to say the entire scientific world, whether or not they're funded by the industry. It's independent scientists who disagree with our conclusions. So I just want to be really clear, because we get some studies that report certain findings. We made some assumptions in our analyses, and other people, other scientists would question that. And we have to continue and debate. And I hope the scientific process will resolve this. But I'm comfortable with what we've done, and I think it highlights how we need to do better research to get better answers. And the few studies that have achieved that seem to find no benefit, and so support the drink less, live longer, and probably drink less, live better kind of message.
That concludes part 1 of our 3-part series with Professor Tim Stockwell. Look out for part 2, in which Professor Stockwell talks about the criticism he received from big alcohol, including even having his life threatened. Thank you so much for listening. For more content like this, you can check out our YouTube channel at alcoholfreelifestyle.com/YouTube. You can follow me and send me a direct message on Instagram and TikTok at James Swanwick. And you can see the results of our scientific study at alcoholfreelifestyle.com/study. If you'd like to apply to become a Stop Drinking client, you can visit alcoholfreelifestyle.com/project90. I wrote a book called The 30-Day No Alcohol Challenge, which you can find on Amazon. And you can always email me directly at james@alcoholfreelifestyle.com. If you're a regular listener of the show, would you please do me a big favor and give the show a rating and a review? It helps us get more listeners, and you'll be potentially helping someone else out there who's struggling with alcohol to find us, to listen to us and get support. Thanks so much for listening. We'll catch you on the next one.